Good afternoon and evening, everyone. This is Heather Schofield with Biomed and Terramedica. Thank you for joining tonight our webinar on melatonin with Dr. Gurinder Dayal. Dr. Dayal, he is a naturopath that's practicing in Vancouver, and he is a certified lecturer for the International Academy of Homotoxicology. He's attended training sessions across North America and Europe, and he lectured extensively for HEAL across Canada from 2004 until just recently. However, as many of you know, HEAL is no longer available. Dr. Dayal was also a supervisor and is currently a guest lecturer at the Boucher Institute of Naturopathic Medicine. His highly successful approach focuses on all aspects of the individual to find where disharmony lies. This includes not just physical symptoms, but also the mental, emotional, and spiritual aspects. Tonight, Dr. Dayal is going to be speaking about his experience and giving us lots of great information on melatonin. One of the things to know is melatonin is well known for its sleep function. However, there truly is extraordinary benefits beyond just sleep, and this is what Dr. Dayal is going to be talking with us tonight. Okay, so with that said, I'm going to pass the presentation over to Dr. Dayal.
Hello, everyone. This is Dr. Dayal. It's a pleasure presenting my first webinar with Biomed. Topic being melatonin and this exciting new product that I've had the pleasure to use and work with just in the last little bit. I've been using melatonin obviously for many years with patients for different types of issues, but yeah, research has shown over the last 10 years or so, that there are many, many more uses and benefits that it has, and I'll definitely be going through and sharing a lot of that with you tonight. So here we have that new product, and I've used it with a bunch of my patients, a handful of them so far, and it's been interesting. I've seen some interesting results historically, as most of us, I believe, we're used to dosing very, very gently when it comes to melatonin, a 1 milligram or a 3 or a 5, and now it's been interesting using it with much higher doses, especially if we're working with cancer patients, where I'm dosing it much higher to 40 and 50 milligrams. But we'll go through that as we go on through the presentation today. So as you can see, melatonin, there is B6 along with it, just 10 milligrams of it, as that does allow absorption to be a lot easier. That's what's been shown. So it's a combination, 10 milligrams of each, that someone would take at night before bed. So the agenda today, we'll quickly go through what it does, its primary uses, most uses that a lot of you are familiar with and what it's been historically used for, but we'll get it right into additional benefits as well, and then new evidence found in the studies. I'm not going to I won't be going through the specific studies per se, but I will be going through the findings, knowing that we just have a certain amount of time to go through as much as we can tonight. So we'll go through melatonin's role in immunomodulation. This is a topic that I know it's very near and dear to me. I've been lecturing about it for 10 years plus, and it's really exciting to see that there's immunomodulation that could result from something that like melatonin, and not necessarily having to rely on the typical things that I've been used to, the probiotics and the Traumeel and whatever not. Its role in brain injury as an antioxidant, cardioprotective, its use, a much higher use in aging. GI protection, which is an interesting one as well. I know many of you must realize that so much of it is actually produced in the gastrointestinal tract as well as a pineal gland. And a very exciting thing is its use in cancer, and that Unfortunately, we're not seeing so much, a lot of studies being done in North America, but a lot of the studies that have been done are in Europe, and it's been great going through them and seeing what kind of findings have come up. We'll go through dosing parameters afterwards, and then we'll go through a very quick summary. So, as we all know, it's the hormone that regulates sleep, and as we age, the production by the pineal gland and the gastrointestinal tract and many other sites throughout the body, it decreases with age, as do many other things, many different types of hormones and neurotransmitters and whatever not. But taking melatonin would definitely help regulate normal sleep patterns and improve sleep quality. But the main thing that I've seen over and over again is the body patterns, and it's not necessarily just sleep patterns, but rhythmic patterns of the system. When there's a natural rhythm that you get, there are a lot of many different functions of the system actually totally start to align and balance. I'll definitely go a bit more through that as we go on. So the benefits go beyond improving overall quality of sleep. I mentioned as an antioxidant, that's a very exciting thing that it's starting to be used at much, much higher doses. And in addition to that, as an anti-inflammatory, not necessarily just for aches, pains, and things like that, but we're looking at brain injuries of all different types. It could be, like atherosclerosis, risk of stroke, that kind of thing as well. The neurological system, knowing that so much, well, the fact is that it actually crosses the blood-brain barrier. So that in itself, we could see a higher concentration in the central nervous system, much more than the blood. So it really is an excellent neuroprotective agent as well for heart, as well as cancer prevention and protection. Obviously not protecting the cancer, but our bodies. So who is at risk for melatonin deficiency? Here we have a list of many types of people. What we're primarily used to using it for is shift workers, airline pilots, flight attendants, flyers. People that fly often go through different time zones, especially when it's over 2 time zones. Surgery, it could be spinal cord surgery, it could be post-gastric type of surgery. It's also used for the eating disorders and irritable bowel syndrome. These are issues that could be helping the mental emotional relaxation, that component, but also sleep in these kind of people that are suffering from these kind of conditions. Chronic fasters as well. It's necessary for a lot of people that are going through these kind of difficulties to get into a general rhythmic an equilibrium rhythmic type of a state. People with delayed sleep phase syndrome is another thing we use very commonly. Depression, anxiety, it has helped quite a few people with that. Females that have a lot of cramping, it could be used for as well. And for some people who are on certain drugs, especially antihypertensives and many of the statin drugs, you could see melatonin deficiency. So melatonin in a high dose supports the body, and it would be helping to resolve a lot of the typical things, like I said, sleep type of issues or jet lag, but also seasonal affective disorder, along with vitamin D and just the use of other tonics. The melatonin could definitely be a big factor for people getting a much more restored type of an effect from their sleeping through the different cycles that go through the night. Anti-aging, cancer as well, it could benefit people that have those kind of issues, so melatonin in high doses, would react quite differently than using just low doses for people that have those issues. So for a lot of people that we see in our practices, this is so common. There are 2 times I feel stressed, day and night. A lot of those people, you might notice that melatonin may not be, like helping people as much as you'd like to see. Like it's the go-to medicine that I see a lot of people come in having used in the past. Maybe they haven't used such a high dose. I know a lot of us have been thinking for many years that 3 milligrams is a high dose, but we're getting into the 10s, 20s, 30s with people as well. So you'll notice that stress plays such a huge role in the sleep cycle, and sometimes melatonin may not be the only thing that's necessary, and I'll get into a lot of other things that could be going on that would further enhance people breaking out of that cycle of not being able to get that restful, restorative sleep that's so necessary for all of us. So insomnia versus benefits of sleep. As we know, a major reason of insomnia is chronic stress, but we need sleep for repair. We also need it to make sure that our system is rejuvenating through the night, and a regeneration. A lot of the tissues on a cellular level, a lot of these mechanisms are actually active throughout the night, and it's absolutely necessary for us to go through and have the different phases of sleep. So restorative functions like muscle growth, tissue repair, protein synthesis, growth hormone release, it's occurring during sleep. Sleep is one of the most important times, not necessarily just to get that rest for ourselves, but also for so many of the typical mechanisms that our body is actually naturally going through every single night when we go to bed. And it's absolutely a must for us to get that time. But it's not just melatonin and sleep that's actually happening. It's not like our body's dead during that time. It's a highly active metabolic time for the body to go through and really repair itself, and I'll be going through that a bit later as well. So you want to be making sure that you're restoring that sleep biorhythm. It's the rhythm aspect of it. It really enhances people's results when they are able to go to bed at pretty much the same time and go to sleep. Within a half hour of an allotted time, and get that routine going. It's really important to actually do that, to make sure that, they don't get into a chronic stressful type of state. And obviously from that, many things could occur, a lot more complex type of issues. So additional benefits of melatonin would be things like ability to control the oxidative damage that happens throughout the body. That could be because of diet. It could be because of certain things that are in the system that would be causing that, certain toxins that we're breathing in and eating and absorbing through our skins. That's constant. We can't really get away with those kind of things, but what we can do is make sure that our lifestyle and how we support our bodies could make it minimal. Reducing trauma related to brain injuries. That's another thing that could really help with that. May also offer neuroprotection, like I said, and increasing cognitive function. Obviously, with much better sleep, you would be getting an increase of cognitive functioning. We'll all know that we're going to be a lot better functioning if we do get that proper sleep. It also helps to reduce toxic effects of chemotherapy and cancer as well. So the new evidence, like I said earlier, it's been uncovered in the past 10 years. It's now known to be produced in multiple body sites, not just the pineal gland and the gastrointestinal tract, but it's something that's I'm not very clear with exactly which other sites, but yeah, it's something that's showing up in some of the research. It's able to cross the blood-brain barrier, so that's a very important thing for the whole central nervous system. And it's derived from tryptophan. Its molecular structure allows it to be a very important and impressive antioxidant. So L-tryptophan, as we know, is something that is also a precursor for 5-HTP and serotonin. It also is for melatonin. It's also an anti-inflammatory. It has those qualities, and the good thing is that it may inhibit the COX-2 without inhibiting the COX-1. So the typical types of side effects, the gastrointestinal side effects that a lot of anti-inflammatories would have, this wouldn't be the case with melatonin, as it's not inhibiting the COX-1. Also promotes a healthy immune response, and that's also very, very important, something in early stages of wound healing. So if you have an increased dose of melatonin, it could be used not necessarily to block the inflammation cycle, but it could definitely help with making it so that the inflammatory system, which is the natural system of the body to actually heal itself, it'll further enhance it to do what it's supposed to do without having to block healing in any way. So immunomodulation is something that would be helping resolve inflammation, but immunomodulation is also not necessarily just dealing with inflammation, it's also dealing with Th2 rigidity, which would be more allergic type of cases, which I'll be talking about in a slide in a few other slides that are coming up. It's immunomodulation would be making it so that T regulatory cells would be upregulated, so there'd be more of a balance between Th1 and Th2. Here, we'll get an idea of more of exactly what I was talking about. In the presence of cortisol, an immature T cell would be more geared towards a Th2 response, whereas with DHEA, it would be more geared to a Th1 response. If someone gets stuck in a Th1 rigidity type of a state, and that becomes chronic, here we're talking about chronic inflammatory type of disorders. We have an upregulation of certain cytokines, where we have interleukin-2 and tumor necrosis factor and IFN gamma, interferon gamma. So the inflammatory response, if it gets into a rigid state, the result would be something like RA or MS. We're looking at tendinitis that doesn't go away, many cardiomyopathies as well. Crohn's is another disorder that would be something that would be a result of someone being stuck in a Th1 rigidity state. In the presence of cortisol, we see Th2, and what we see a lot of in our practices is a lot of people that do have an issue with cortisol, high stress, what I emphasized on a bit more earlier on. And Th2 rigidity would be a result of that. Here we have different types of interleukins again, but the result of that happening is allergy. And it may start as allergy, and as someone gets stuck in a state of Th2 rigidity, you'll see certain conditions like asthma You'll see eczema. You'll see allergic rhinitis that doesn't go away no matter what. Chronic fatigue syndrome. And you'll notice if someone stays stuck in that state for the longest time, they may have issues with fatigue, but another thing that would happen is they'll also get to a state where the immune system could very easily get into a state of non-reactivity. That's where things get very dangerous. Someone will come up into your office and they'll be like mentioning to you that they'll mention that you know, they have metabolic syndrome, they have diabetes, they may have some cardiovascular disease, they have all these things going on. But when you bring up the immune system and you mention the immune system to them, they'll mention that they haven't had a cold in 5-10 years, some of them. And what they're believing is going on is that part of their system is strong and active and it's taking care of whatever is going into their system, but that's not at all the case. Their immune system is actually in a state of non-reactivity where it's very difficult for that immune system to even recognize or muster up a response for a lot of things that may be going into the system. So one thing that's absolutely necessary in those kind of cases is the necessity to actually get the immune system to start to react and respond. That's one of the things that I'll be actually testing with melatonin at high doses to see if we would be able to induce a fever-like response, induce like an inflammatory response that's important for the body to break out of that state, especially if someone's in Th2 rigidity. So that's definitely something that I'll be working with, especially if I don't have the heal products like I used to that I'm so accustomed to using in my practice. I'll be looking for other alternatives, but I'm very excited about the fact that this is an immunomodulatory medicine that could be used for that as well. So cortisol release, as we know, cortisol levels, they naturally decrease at midnight, or the hours that are getting closer to midnight. So cortisol doesn't stay the same amount throughout the day. It goes through different levels. Hence, we do the salivary hormone test to check the different times of day and what the levels are at the different points. What you'll notice is it's supposed to be very low at night. But what happens naturally in the body during that time is it goes through a gentle inflammatory response. That's why a lot of people, when they wake up in the middle of the night, there's heat, and when they're very, very like overly toxic, or they're going through any kind of metabolic type of issue, another thing that could be going on is their system, their detoxification mechanism is in overdrive, and it's not having the required necessary cofactors. It could be the necessary things that the adrenals, the liver, the lymphatics would need for those processes to actually work the way they should be and efficiently throughout the night. So during that time, the lymphatics are moving through, like toxins are being packaged through the lymphatic system. The liver is working. As in Chinese medicine, we know that the liver time that qi flows through is between 1 and 3 a.m. And for a lot of these people, that's when they wake up. And there's this break in qi flow as well that occurs for these people. So it's really, really important to make sure that those systems are detoxified, because it's a body's natural rhythm to actually go through the night and have that restful sleep, but to detoxify so that in the morning when one is waking up, the body's design is to wake up and you're able to defecate and urinate any of the toxins or byproducts of any of the reactions that are happening naturally in the body to clear the system at that time. If that's not happening, or it's happening very inefficiently, it's extremely important, or if it's not happening, you'll notice that your sleep will start to get less and less because the cortisol levels may start to increase or stay increased throughout the night. And if they stay increased throughout the night, it's not just an issue with the pineal gland here. There's a very definite issue of the extracellular matrix in that system, that person's body, that needs to be cleared through detoxification. So I'm not talking about just a bowel cleanse or anything like that. You would be using specific medicines that, and what I've noticed through my experience with HEAL and through other companies is biotherapeutic drainage or homotoxicology medicines that are working in certain dilutions to work with drainage of certain organ systems depending on how someone's symptomatology is. It's extremely important to go through and work on that level of drainage to make sure that those primary and secondary emunctories are working to the best of their ability. So I've gone through most of this slide as well, really illustrating that inflammation is absolutely necessary, and that's why our bodies do get heated throughout the night. But it's also necessary to detoxify. And what I've seen over and over again with people is they may have tried melatonin, very high doses of melatonin, but for some of those people, it's absolutely necessary to detoxify their systems. And for some of them, once that starts, even 2 weeks into a biotherapeutic type of a detox, they'll notice that their improvement of their sleep is quite drastic very quickly. The other thing I want to mention is, in order to detoxify properly, it's extremely important to make sure that the body's hydrated. I always tell patients to drink at least 2.5 liters of water, and best if it's not at night or right before bed, although a lot of people get a dry mouth during that time. It's extremely important to make sure that they're getting it before noon. So I get a lot of people to drink at least a liter of water before noon, and then at least before 6 or 7 p.m., especially ones who have that problem with waking up in the middle of the night to urinate already. The exciting thing here is this is a concept that I've really emphasized on for many, many years. And now knowing the effects of melatonin as an antioxidant is very exciting, because during that time of night, it's not necessarily just helping with sleep. It's actually helping with what I just described, that whole cascade of events that are happening throughout the night. So that's very exciting. And at a high dose, I'm not so worried about someone not feeling good by the end of the day, or when they wake up in the morning and having drowsiness or something like that. They're not supposed to with melatonin. If they are, the dose may be extremely high and you may decrease it a bit, but knowing that throughout that night, the efficiency of this cleaning up that the body naturally does is going to be so much more efficient. That plays a big role. I really wanted to emphasize on that. Here we have a slide that goes through a typical normal tissue cycle. Obviously, our body goes through different types of stress throughout the day, and the inflammatory response is important. So you have those 5 different stages that it goes through. throughout its cycle until the matrix starts to synthesize these things again, and then, you know, there's homeostasis, but it's a continual cycle. So I just wanted to emphasize how important inflammation is. And if that is blocked, the result is either instability in the genes or senescence, which is aging, and that's how important going through inflammation the way you're supposed to without blocking it fully, like a lot of the anti-inflammatories do. It's so important to make sure that it's going through those stages so the matrix is supposed to so it's able to synthesize properly and to regenerate a lot of the cells that do die off and slough off. So if inflammation is blocked, we're actually depriving the body of being able to do that. So that's how important immunomodulation is. Remember that. And through a lot of the different studies that I did go through, preparing for this presentation as well, it was great to see that that it was showing that it was actually affecting type 1 and type 2. That was something so important for me to hear, knowing that I don't have Tromio at my disposal anymore. So melatonin with the use of brain injury, I've already mentioned a little bit, but it's a powerful free radical scavenger with anti-inflammatory effects. Usually with children and young adults, melatonin will be used mostly for head trauma. So it could be a car accident, it could be a blunt hit on the head, that could be through playing baseball or a ball or a puck if you're playing hockey, that kind of thing. That's where you'd see it most of the time, or a bad fall from a tree or something like that. For older adults, complications with brain injury is more to do with blood flow and atherosclerosis. So in that, this melatonin could be very beneficial as well. So the effects of antioxidants, it'll reduce the chemicals produced by oxidation, natural oxidation that happens in the brain. In addition to that, it increases levels of other antioxidants, such as vitamin C. It decreases the activation of pro-inflammatory cytokines, so it'd be helping in that sense, so that the body also doesn't have like a chronic release of these cytokines. That's where it gets dangerous. These cytokines are necessary for the certain phases of inflammation, but if it gets to a point where something starts to become chronic, either in type Th1 or Th2 rigidity, that's where aging very rapidly increases, and we could get a lot more complicated types of disorders. So this decreasing the activation of the pro-inflammatory cytokines, this in itself would also help in reducing the size of that inflammation, so the size of the brain contusions following any kind of head trauma. In cardioprotection, it works in a similar kind of way, so it's scavenging free radicals. It's also increasing the enzymes that are acting as antioxidants, preventing oxidative damage. As you can tell, oxidative damage is one of the main things that could really cause a lot of issues in many different organ systems. So you're going to notice when I'm talking about the heart, if I'm talking about the neurological system, it's the prevention of oxidative damage, which is really important, so that the mitochondria could also continue with respiration and allowing energy production to continue at a very efficient manner. Also, what's been found with some people, some studies, is the beneficial effect of certain heart medications. So the great thing would be the dosage of those heart medications may not have to be as high as they may have been. In addition to that, reducing blood coagulation activity. That's another thing that was found. So another thing, decrease of the nighttime hypertension. So some people have high blood pressure, or it just shows up just in the evening or at nighttime. There's also a decrease of risk of angina or heart attack that was found in some studies as well. So with aging, so the effectiveness of supplementation may increase with advanced aging. As we know, those levels of melatonin drop, but for a lot of people, depending on how much they have dropped, and it's something that's not readily tested, increasing that dose for people that are aging could be extremely beneficial for them. So I'm talking going right into whatever they can tolerate. That could be up to 40 or 50 milligrams taken at night. That can make a big difference for these patients. And a lot of us practitioners aren't used to dosing melatonin that much. And I've been amazed so far with a handful of the patients that I've used with this product, knowing that, you know, with 3 milligrams, not much was happening, but with 10 or 20 and them tolerating it okay, there's been a better effect by far. So with aging, getting back to this slide, there's calcification that happens with the pineal gland, and that's something that does happen naturally with aging, which would cause this decreased capability to produce it. In addition to that, memory function would not be the same. Daytime tiredness is another thing. So there's various sleep disturbances. I've heard so many different types of sleep disturbances throughout my practice so far that there are a lot of different patterns that exist when it comes to that. And for many of the aging, I've noticed they've been having these issues for 20, 30 years. So we're not looking at something that just started. We're looking at people who have been waking up at 4 a.m. or 5 a.m. for many, many, many years. So we're not just talking about acute situations. And for those type of situations or conditions, it's many times very important to dose it appropriately. Gastrointestinal protection, it produces, the gastrointestinal tract in general produces more than 500 times more melatonin as a pineal gland. I found that really interesting. I never knew that before, but researching it, very, very interesting knowing that. And some people say that it usually is released right after a meal, and in that, it hasn't been proven, but a lot of people say, you know, it may be that feel-good effect or that tiredness or that sleepy effect people get right after a meal. Obviously, we know physiologically there could be many different conditions or imbalances that could be getting someone to feel sleepy right after. That could be a blood sugar issue as well. It could be an adrenal issue. There are many different conditions that would cause that kind of thing. But yeah, I found that interesting. It's also found to be effective in trauma due to strong acid and digestive enzyme exposure that would be produced by free radicals. And it also stimulates blood flow into that area, therefore, you know, getting that inflammatory response, the natural inflammatory response to resolve itself a lot faster and a lot smoother. And once again, just like other aspects of the body, protection from oxidative damage, just really so important. Its role as an antioxidant. As you can see, it keeps on popping up with every single system that I'm going through. So other things like GERD is something that may benefit very well with melatonin. If there's inflammation just in the cardiac or the pyloric sphincter area, that's something that could really make a big difference. IBS is another thing that could be affected in a good way. In addition to that, clustered headaches and migraines, a lot of gastrointestinal upset. It is like a GI migraine sometimes, and a lot of people do refer to it as that once in a while. So it's interesting that it has that effect, the similar kind of effect for the gastrointestinal tract. Its role in cancer prevention and control. This is really exciting. Studies show that 40 milligrams per day starting a week prior to treatment could improve tumor killing power of interleukin-2. But remember, that was one of the interleukin, the cytokines that came up for the type 1 type of response, which is extremely important in fighting cancer. So really regulating that, especially if someone is stuck in a Th2 state, that makes a lot of sense. So it's really great knowing that melatonin at high doses could really help really make sure that that person is breaking out of Th2 and we're trying to get that Th1 response to activate in order to fight the tumor. So studies are also done with this lower dose, 20 milligrams with chemotherapy, showing without and with, and it showed more beneficial results if it was used with chemotherapy. So it's also shown a reduction of prostate cancer cell growth rates as well. So very exciting knowing that that it could work on that level. It also increases REM sleep for these cancer patients. So that sleep is extremely important for healing to occur. And also other things that could happen with cancer patients is lower platelet counts, neurotoxicity, cytotoxicity on the cell level, mouth sores and things like that. This would be something that would be helping some of the complications that come from either chemotherapy or cancer itself. So when to dose it, usually 30 minutes to an hour before sleep. Exposure to light at night really messes things up. That's the simplest I could put it. So I get a lot of people that have a lot of, if there's anything to do with insomnia, if they have sleep problems, I make sure that they're darkening their room as much as possible. And they're not really using any kind of electronics at least an hour before bed. It's extremely important for that. So when I say completely dark room, their clock, their LED clock would be in a cupboard, or it could be in a night table. Like there should be no light whatsoever. And that in itself makes a huge difference for a lot of people, along with taking some products like melatonin or anything else. So that exposure to light could really suppress and decrease those melatonin levels. And many times it doesn't matter how long that duration was, that interruption will make a huge difference. I was very happy to hear that, there was one of my patients who I put on the melatonin. She's actually actively going through cancer right now. And I had her on 40 milligrams. And she had mentioned 10, 20 was fine. But once we started going into the 40s, she really started getting the GI upset or the nausea. The nausea was the main thing that kicked in for her. And it was great, with the L-glycine, the 500 milligram powder that's coming out, that with that help, that'll help tolerate the B6 and the melatonin a lot better. Very good. I'm so happy to hear that. And so I'll definitely be putting my patient on that right away because I do want her on the 40 milligrams per day for sleep issues, but also for the cancer and it being such an excellent antioxidant. So that would be 1 scoop a day, but honestly, like you could increase the dose. If it is a very high dose of melatonin, you could take up to a teaspoon of the L-glycine, and that would equal to about 5 grams. So another thing I forgot to mention here is a lot of people might be wondering about side effects and things like that. Or contraindications with melatonin. Things that I came across are avoiding people with histories of seizures. It could lower seizure threshold. In addition to that, contraindication in pregnancy, it's not a good idea, knowing that it could alter the pituitary ovarian function. In addition to that, it may induce uterine contraction, and it's a big question mark. We're not too sure if there could be any abnormalities and developmental disorders of the fetus. Also, knowing that it's primarily made with L-tryptophan, the whole alarming thing of, serotonin being a part of that as well, and people being on either MAO inhibitors or SSRIs or triptan drugs for migraines, the possibility of someone getting serotonin syndrome. There's some literature that says it's not really a concern, but I did come up with some people that have had serotonin syndrome being on one of those drugs and also taking melatonin at the same time. So that's something to definitely watch out for as well. And let's see. So in summary, melatonin is formerly a hormone long thought to be responsible only for circadian rhythms and its effect on sleep, but it performs many other pivotal functions in the body, including its antioxidant abilities, the immunomodulation that I emphasized over and over again today, and the capacity to manage inflammation, which is through immunomodulation, and its great use as an adjunct in cancer therapy. Great. That is the end of this webinar. And feel free to ask any questions. And I'll do the best I can to answer them.
Thank you very much, Dr. Dayal. That was excellent. A beautiful summary and go-through of melatonin and its functions well beyond sleep. For anybody that have questions, you can type them into the chat room or into the Q&A section, and what I will do is I will ask them to Dr. Dayal. At the moment, I know that we do have a few questions, so I'll just get started with those if that's okay. There was one question about the contraindication or warning with cardiovascular issues and why melatonin may be contraindicated in those types of cases.
So with cardiovascular issues, it's a big part of it is what I had mentioned with drug interactions. If for me, that's the main thing that comes to mind, being mindful of making sure that the drug interactions, depending on whatever drugs that person is on, making sure that they're not just thinking melatonin is a natural product and taking it in high doses doesn't affect the neurological system in any way and that kind of thing. That's the main thing that comes to mind, that there would be like a label warning. I'd say the drugs part of it, because most people that are having cardiovascular issues, that is usually the case. They are on not usually just one, but a few different drugs.
Excellent, thank you. Okay, so the next question I have here is one of the participants says that I'm very drowsy all morning with 3 milligrams of melatonin, but not so much with 1.5 milligrams. Is there some way to increase and get through this drowsiness, heavy fog brain?
Okay. What I would do for someone that would be going through a heavy fog brain, and yeah, like it's interesting with a 3 milligrams, the sensitivity of people is very, very different. But what I would actually do with a case like that is make sure that the detoxification mechanism is working properly. A person should not be feeling that groggy, taking that low of a dose in the morning. So all of that I had discussed about making sure that that detoxification on the cellular level is happening, that is something that I'd want to make sure. The water going into the system as well, making sure that it's an ample amount, that they're not drinking too much caffeine. A lot of these kind of things are, the lifestyle type of things are very, very important to make sure that the patient is taking care of those things, because they should be able to tolerate 3 milligrams with not too much of an issue.
Okay, excellent. And then I have just one more aspect of that question. There's many people that end up having that light exposure in the night. If they are taking melatonin and they do have the light exposure, could that be causing brain fog or melatonin to react in potentially a way that you wouldn't expect?
If that light exposure is happening for a long duration, there's a strong possibility. If it's happening, if it's just a light that goes on and off, it is going to interrupt it, but I don't think it's going to have too much of an effect, like an overall drastic effect, as it would if that was exposure that was going on for a much, much longer time throughout the night.
All right. Okay, so here's another question about serotonin syndrome. This practitioner is asking what types of symptoms you may see in serotonin syndrome and how to address it or help it.
So serotonin syndrome is something that could cause a lot of anxiety. A person could start to lose consciousness. Usually the anxiety part is, sweating is a typical panic type of a state, and that's usually when there's way too much serotonin going into the system too fast. Another thing is tremors, so it's a really panic type of a state. Other things could be like a passing out. That's another thing to watch out for. Definitely, I'm sure there are more, but you could definitely look that up. But it's so important to know and to make sure that that is a possibility. Although some say that it's not necessarily a big issue, I'd actually think it's a good idea to make sure that you're being very, very careful in the pathway of L-tryptophan to 5-HTP to serotonin and then to melatonin. So serotonin could metabolize or work towards being produced into melatonin, but it's not overly clear if melatonin at high doses would actually do that. And then reading it with some people that have had it with melatonin, with some of these drugs, I'd definitely be cautious.
All right, thank you for that. Okay, there's a few other questions that have come in. Is a lower dose safe for patients with seizure history?
A lower dose, it is individual dependent, but a lower dose, so there's a better chance of there not being too much of an issue. If we're looking at a 1 milligram or even a 3, I wouldn't worry too much about it. But the main thing, going into a 10 plus or even a 5 plus, I'd be definitely worried about that.
Okay. Okay, there's a few more questions that have come here. Okay, one is about what will be the highest safe dose to give?
I personally, what I've seen through the literature is a 50 milligram dose. I've heard of others taking it to a much larger dose, but looking at the literature, I'd say a 50 milligram dose for the things that we discussed today would be a good dose.
Yes, excellent. That seems to be the same research that I've done, and it seems to be what's happening with in cancer clinics and cancer patients, that 50 milligrams is the daily dose that is being given quite safely. Okay, here's another question here. What is your opinion or your experience with time-released melatonin?
I haven't used much of a time released. I've just dosed it pretty much a half hour to an hour before bed. So experience-wise with time release, I haven't done much not done much with that. And yeah, it's more just the dosing time that I've been okay with. And another thing I might have done with patients is if they did wake up in the middle of the night, I just get them to take another dose. So yeah, I wouldn't have much information on that. I've never used a time release with my patients.
Okay, and with having them take the other dose in the night, if they're waking in the night, that is in all the literature with our melatonin B6 product, what is one of the recommendations if patients are waking in the night to take it again in the night with making sure they're not taking it too close to waking in the morning. So if they're waking up at 5 a.m., not to be necessarily taking a dose at that time because that could create grogginess in the morning while they work through it. Okay, here's a second part of that question. What about reports that concurrent use of 5-HTP with melatonin can be used to enhance efficacy? Yeah,
that to enhance efficacy of the melatonin using 5-HTP, that could definitely do it. It's the precursor to melatonin, so it would be similar, I believe, to increasing the dose of melatonin. But in addition to that, the 5-HTP would be helping with serotonin as well. So a person would be getting effects when it comes to the neurotransmitters, the serotonin aspect of it as well. So yeah, it could definitely be used to enhance it.
All right, and then it looks like I've got one more question here. Oh, okay, this is a question, is this melatonin new or different from the normal? And what about taking L-glycine at the same time? That one I might need to answer. This melatonin, the melatonin plus B6, there are other combinations on the market that do exist that are melatonin and vitamin B6 formulas. There in Canada, we do have one or two other companies that have high-dose melatonin or 10 milligram melatonin, but they don't have the addition of the B6 in there. And with the L-glycine, as I mentioned at the beginning of the webinar, I will send information about L-glycine in a follow-up email tomorrow. And so with L-glycine, it's been shown that in cases of patients who aren't tolerating melatonin very well or tolerating the higher dose melatonin, the L-glycine helps for that tolerance, or for patients not to have the GI upset and nausea. Those are some of the main things, or the grogginess or restlessness that could come with the higher dose. Dr. Dayal, do you have anything to add to that?
No, that's about what I would have said as well. That's great.
Okay, excellent. Okay, so if there's any other questions, then here I'll give another opportunity either to type it into the chat room or into the Q&A section. But at this time, I don't see anything else.
Great.
And so, Dr. Dayal, thank you so much. As I already said, wonderful presentation, and you really did cover melatonin in a way that we don't always think about. I love how you emphasized so much about melatonin's ability and how it efficiently cleans the body at night. And this, I think, might be one of its true and honest keys to why it's such a strong product for health, and especially the antioxidant and anti-inflammatory aspects as well.
Great.
And yep, so that's it. I don't see any other questions. And so thank you, everyone. And thank you, Dr. Dayal.
Great. Thank you, everyone. Thank you for your attention. And yeah, happy results with melatonin at high doses.